Is that you talking? Maybe just text me the question and I can repeat it for them. And just while we're waiting, I'm just kind of curious, just Paul and Wally and anybody else on the line that wants to chime in. What makes you come to work every day? What's made it worthwhile? What's the thing that makes you, keep ticking in emergency medicine?
Well, for me, it was two. It was patience. Number one, as Paul said, the challenge of coming to work every day and being faced with, the question mark, and having to do it in a time sensitive situation, was something that I always enjoy, and I still enjoy it. And I think the second, for me as a residency director, was always the residents.
Always what?
It was always the residents. We had 4 years to get them to the top of their game. And that once we got them to the top of their game, they were going to be fine. And then the good news is they were going to go out and continue to teach and continue to make other people great. So for me, patience always. It was, many of you might know I've done a ton of stuff on the national level, different boards and the NCGME and things like that. And I did those because I thought they were of service to the specialty. But my sweet spot was always in the ER. My sweet spot was always in the ER and always working with residents. That's what got me up every day, and that's what still gets me up every day. And I still, there are days that, it's like, okay, I'd rather be sailing, I'd rather be on the water. But I still know that even though I'd rather be there, maybe where I'm going is a pretty incredibly neat place, and it matters. So I think that for me, that was mostly it.
For me, there were a couple of components. One of them was definitely the action. I mean, I really was kind of addicted to the action in the ER. The other is this concept of short-term problem solving. Turn everything into a problem to be solved within your shift, and it becomes a interesting intellectual process. So those two combined always represented to me the centerpiece of what got me up to go to work every morning.
And it can be, and again, I think Paul's point is well taken, and I mean, I think you should think about it. But I mean, it's not only come to the work in the action, but if you decide that you want to go into residency training, or you want to go into operations, or you want to whatever it is you think you want to do in addition to your clinical activities, each and every one of those is a problem to be solved. How do you fill X numbers of shifts with Y number of residents? How do you get X numbers of patients admitted to Y number of beds? How do you decrease your throughput time? Whatever it might be. That's what's interesting about emergency medicine. Every day we're faced with a new challenge. And the thing that's interesting is, we don't get a chance to pick what our next challenge is. Nobody picked on a multiple choice test, crack and automatic weaponry. Nobody picked heroin. Nobody picked homelessness. Nobody picked HIV. Nobody picked multi-drug resistant TB. Back in the 80s and 90s, it came to the ER. So, if you look at that as a constant challenge, you will be challenged, and you will be asked to think outside the box before anybody else does, because you're in the ER. You're going to see it first. And I think it's a hell of a place to be, and I think it's a privileged place to be. I mean, we get a chance to see it and tell people before anybody else knows it's happening that we're seeing it every day, and we're already coming up with the solutions for it. That is incredibly neat.
And sometimes it's really funny. Sometimes things happen in the ER that couldn't happen anywhere else. I was thinking about.
So, why don't we wrap up with? Why don't you guys both tell us your funniest moment at Jacobi? Patient moment.
Okay, I just want to ask Wally if he remembers this, or if he was already gone to Bellevue at the time. But remember the Battle of Booth G? Wally?
Yes. Yep.
So a patient comes in. It was in the late afternoon. A patient with a massive stroke, essentially brain dead on a vent in booth G on the medicine side. That doesn't mean anything to you guys, but it does to us. It was the last booth down on the left-hand side of the ER. So at the time, there was a neurology service that actually took care of patients in-house. So they had a ward. And of course, there was always the medicine service. Of course, we tried to admit the patient to neurology. It just seemed reasonably fitting. And of course, neurology rejected the case. We then tried to admit the patient to medicine, and medicine, of course, said, it's their case. This is a neuro case. It's a stroke. What are you asking me for? And it went back and forth for hours. And eventually I came into the case and I said, look, this is what we're going to do. I'm going to get the head of medicine and the head of neurology to come to the bedside and talk this through and make a decision. So I get Dr. Bob Meyer from medicine down to the ER. I get Dr. Jack Kessler from neurology down to the ER, and they start to talk and debate and argue. And as they're doing this, they're getting louder and louder. I don't know if anybody knew Jack Kessler, but he was really loud. And eventually, as it was going back and forth, it started getting a little tense until somebody said, well, you, I'm not doing it. In which case it went back to Kessler, and Kessler said, you, and this went back and forth with them screaming you at the top of their lungs, with patients right around them, with patient families around them, with residents absolutely stunned, listening to the two chiefs of service saying you to each other. And eventually they worked things out, and the case was then referred to the medical director of the hospital, who threatened to fire both of them unless they both took anger management classes. And eventually the whole thing, dissipated, and we were back to normal again. But to see two chiefs of service, stooping so low in the middle of a crowded ER was remarkable and funny.
Oh God, Mike, I can't. God, there's so many things that it's funny. One of the first things that popped into my mind was a very similar story. Chucky Martinez was on the medical side, and at nighttime, the psych ER was covered by faculty from psychiatry, and it ended up being that night was the chairman of psychiatry was covering 4 hours in the psych ER, and he and Chuck got into a bit of a tussle. And the old Jacobi going back to the elevators, he was walking back to psychiatry with his team, and he and Chucky just got into the same thing. They got into an FU match, and shouting at each other louder and louder and louder. And Chuck followed him all the way into the main lobby of Jacobi. And the next day it was kind of brushed under the table. And I think the other story that I still remember to this day is the Rich Siegel story back in the old 126 area.
Oscar Jackson,
OJ, and there was a trauma, and Oscar Jackson was a surgical resident who, memory serves me correct, was a middle linebacker for The Ohio State University. It was just a massive kind of a guy, and Rich Siegel was incredibly thoughtful and just a very wonderful attending, and totally a gentleman about the whole thing. And there was they wanted to put a chest tube in. There was a surgical intern who kept getting in the way and wanted to listen to heart sound. I don't know what he wanted to listen to, but he had no business being he was in the way. So Rich kind of put his hands gently on his shoulder and says, you got to move. And Oscar Jackson on the other side of the stretcher saw this and said, you can't touch my intern. And it was interesting to me because I know that the spine is supposed to flex. I didn't think it was supposed to flex in the opposite direction. And he literally took Rich and laid him back across the patient's belly and held him there. And the next morning, the chairman of surgery came down to the ER, and the answer was, well, boys will be boys. It's the way we do things at Jacobi, and let's just shake hands and go back to work. But again, it's amazing how all the stories had to do with incredible escalation and then de-escalation maybe it just speaks to the craziness of the moment. And there were so many stories. I mean, probably a better thing, Mike, to do after this, which is not virtual reality, where we can actually get together and open up some wine and tell some stories, because these are great stories.
Yeah.
Absolutely. Looking forward to the day we all can pour a glass together. So, yes, if nobody else has any questions, I know we've been on for about an hour. Really want to thank Dr. Gennis and Dr. Carter, two Jacobi legends. And hopefully, coming weeks, we're going to do this again. If anybody else has any other last questions or last comments, but others, we'd just like to thank Paul and thank Wally. Really wonderful to see you both and hear from you both.
I'm just going to say one thing before I sign off. I've done a ton of things. I started 2 programs. I've been around the country. To this day, when people ask me, things that what I'm most proud of, it's a couple of things, but it all started on Pelham Parkway. It was being Paul's chief resident. I was being Paul's associate director and being JIT trained. There is nothing anywhere that I've ever bumped into that I can't take care of. And I am supremely and absolutely always proud of being a Jacobi grad, and people see it in the way I take care of patients. They say, "Where did I learn that?" I'm like, Jacobi. It's just the way we do things. So that's all part of the legacy. And it will hopefully continue for another 40 years.
And I want to reiterate what I said at the beginning. I thank you guys all for getting out there in the front lines and helping to save civilization.
Amen.
Awesome. Thank you all.
Be safe, guys.
Be well, stay safe, and hope to see you all soon.
Okay, take care.